So what makes a quality environment? So obviously the most important thing in any early education program are the educators. And with those educators, we're looking at how they speak to children. So it's the quality and the level and the sorts of interaction which takes place between the child and the educator. The knowledge of what the curriculum is. And often we will take these beautiful curriculum models. I know that New Zealand, you've probably all heard of New Zealand, and we take those curriculum models and we transfer them outside of their environments, and we try to layer them on top of some of our early education programs here. But what we miss is that the people delivering that program in New Zealand have degrees. They're highly educated and trained, and they've been well trained, and they developed that program. That's theirs, they own it. When you import these things into a setting where people don't have that level of training, they haven't been part of the development, and they don't own it, you don't get those same sorts of results. And then we get cross with them because they're not giving us the results that they're getting in New Zealand. Obviously, knowing how young children learn, helping children resolve conflicts, and this last one about helping parents support their children's learning at home, which across the board, if anybody finds out how to do that really well, because I think it's a very difficult thing to get early educators to really engage with parents in a mutually respectful way. And I'm sure that there are good examples of it happening, but I would have to say that across the board, we don't find it happening very often. This again comes out of the UK, and I'm giving you the UK because this was done on a population level. That they looked at assessments on a population level. We could find similar examples of research on smaller populations in Canada. So this is the effect of preschool on literacy. And what you see is that preschool raises the bar for everyone, whether or not you came from a professional family or a low-income family. But so these are kids that got preschool. These are the kids that didn't. So the kids from the professional families are going to do okay, right? Even without preschool, they'd do better if they had it. But it's this group of kids here that without preschool, they're not likely to catch up. And we know from other longitudinal research that if you're behind when you're at age 7, you're likely going to be behind throughout your educational experiences. But because low-income families are more likely to have difficulties, we sometimes misinterpret those findings. So this is information that comes out of the National Longitudinal Study of Children and Youth. And what you see is this nice sort of gradient. These are the kids that are delayed in their language abilities. And we see that kids from low-income families are more likely to have development vocabulary delays than what kids from affluent families are. But it's also worth noting that most kids from poor families are doing quite fine. That's the role that parents play. That's the role that good preschool intervention plays. And that we tend to focus in our public policy on these kids here. While neglecting the other kids. Also, in terms of concern, we should be concerned about this gap between low-income kids, but there's also a big gap between affluent kids and middle-class kids, which also needs our attention. So just keep this in mind. These are percentages. But when we look at here, which is the actual numbers, so these are the numbers of children that are having vocabulary difficulties. So the oranges are the number of kids that come from poor families, and here are the kids that are having difficulties with their language at age 4 and 5 who come from moderate, middle class, and affluent families. So they far outnumber the poor kids. But yet often our public policy looks at, we have limited resources, let's target them to the low-income kids. But what happens when we do that is we tend to miss the majority of kids that are having difficulty. So again, for those of you that want to, raise those, standardized test scores in grade 3, grade 6, and beyond, you're not going to get those population changes if you only focus your efforts on low-income families. Now, there's more to early education and literacy levels than what exists in the classroom, and I find this one very interesting. It was the result of a collaboration between the Organization for Economic Cooperation and Development and Stats Canada, and it divided literacy levels into three levels. I mean, what we find is that really people functioning with high levels of literacy in Canada is about 30%. You need to really be at level 3 in order to function reasonably in the sort of economies and social environments that we are in now. But we still have about 35 to 40% of Canadians that are operating at levels 1 and 2. So that means that they can read, but they can't read enough to actually inform an opinion. They can't really read enough to follow basic instructions, those sorts of things. But there is this big connection between literacy levels and the likelihood of people engaging in civic activities. And that might be from voting to being involved in their church or a health, or a civic endeavor. It's sort of the difference between what's happened in Calgary after the floods, and the whole community came out to support those that were in trouble, and what happened in New Orleans, when if you could get out of town, you did. This really talks about the social inclusion that's in your society. And the levels of social inclusion depend a great deal on the literacy levels of your population. So this gets to, can we afford it? And many of you, I'm sure, are familiar with the famous Perry Preschool study, where $1 spent in the early years delivers $7 or more down the road. Very interesting work, but on a very small number, carried on a very small number of children and a very limited experience. We now have a number of Canadian studies which are really showing us some very interesting things about, in the Canadian context, what sort of impact could public spending on early childhood education and care have. And this study was done just following the economic crash in 2008, when the federal government was developing its economic plan. And it was done by Robert Fairholm, who's a well-known economist. And so he was looking at what the effect of public spending in this area would be on the gross domestic product. And you find that, in fact, childcare and education have the biggest bump on the GDP. They're also the biggest job creators. So if you want to bump up your GDP, if you really want to create jobs, if you want to create local jobs that stay in the economy, where people actually spend their money in their local economy rather than investing in Switzerland or something, these are the areas that you should be, there you get the most bang for your buck. Unfortunately, or instead, let's just say that instead, we know that most of the stimulus funding went into construction and manufacturing, which doesn't deliver the same sort of bump that this area does. But the big story actually comes from Quebec. And we find that interesting because it's not a simulated model, it's not a small random control study, it's not on a few people. It's really, this is what happens when you institute public policy for whole population. So we know in 1999, the Quebec government began offering what started out as $5 a day childcare, became $7 a day, and they're close now to meeting demand across the the province for everybody who wants to participate. And when we talk about Quebec, policymakers tend to cringe because they go, oh, Quebec, that's the program that's out of control. But this was a study that was done by a number of Quebec economists and has really got a lot of play when it was released there, because it actually shows quite a different story. So one of the things that happened was, due to low-cost childcare, 70,000 more Quebec mothers are in the labor force. And we all know that mothers work even though childcare is not available. But these were actually mothers that were identified as they would not have been in the workforce if there wasn't low-cost childcare. There was simply too many other barriers in their lives that would have, that prevented them from entering the workforce. So Quebec moms pay $1.5 billion annually in taxes. Because they're earning more money, they draw less in social transfers. They boosted Quebec's GDP by $5 billion. And then there's been what's called the Splatter Effect. I mean, we expect when childcare is available that more parents will be working, particularly mothers. But here's the Splatter Effect. Quebec mothers were the least likely to work in all of Canada. Quebec moms were the least likely to work. Now they're the most likely to work. They actually top labor force participation rates in Canada. Child poverty rates in Quebec have been cut in half. The number of lone parents on social assistance has been cut in half. Fertility has gone up. This was a major motivator for the Quebec government in putting the program in place, but more Quebec moms are having more babies, and it's not just 2 babies, but it's 2, 3, and 4, 3, 4, and 5 babies that we're seeing. And vulnerability at kindergarten has declined for children who attend the CPAs, the Centers for Petite Enfance. And this is very interesting. This is brand new information which has come out in the last couple of months. So Quebec spends a lot of money on this program, $2.2 billion right now. And it's giving them lots of effect on the labor market side. More moms are working, paying more taxes, this sort of stuff. But they're not getting the real bump, what they're expecting in child outcomes. And they're going back to the drawing board and looking at it. And it's largely because for all the spending on early education and care, which takes place in Quebec, not very much of it takes place in center-based programs. Only about 45% goes to the Center for Petite Enfance. A lot of it goes into family care. And while family care may help mothers to work, it's not showing, at least in the Quebec situation, to reduce vulnerability at kindergarten. So when we add up the dollars, we find that for every dollar that Quebec spends, it gets back $1.05 in increased taxes and lower outlays. And as they like to put it, the federal government gets 44 cents for doing nothing. And this is something that they are going to be, that they're in discussions with the federal government about right now. So although we have all this great stuff happening, I'm missing a slide. I hope I have the right version of this program, the slide deck up here. So for all that we know, what we actually find when we deliver early education and care is that there are lots of folks involved. At the provincial territorial level, we've got, many ministries involved in one way or departments involved in one way or another. When we get down to the local level, there's more folks that are involved. And then when we look at the actual, anyways, you're going to get a lot more balls here, but unfortunately I have to go through them all. I don't know why it got set up like this. We'll have to get it changed. Anyways, at the bottom, you see this plethora of programs. When we were doing environmental scans for the early years studies, and when community mapping is done for the EDI and a number early development instrument in a number of communities, what we find is there are a lot of programs out there that are doing something for children, for preschool-aged children. child care family resource programs, there's pre-K, there's, libraries have stuff, the Y has stuff. It seems like everybody is doing something. But then when we asked parents what there was in their community, they didn't know. Or they may have known about one or two things. And the most savvy of them could, join together, the hip and hop program on Thursdays and the library program on Friday, and, then they could make a meal out of it. And those were the best resourced families. Those that were most disadvantaged, even though they were there, even though sometimes cost was, there was no cost involved, the most disadvantaged families weren't accessing those programs. So it says to us as both service providers and those who create the policy about, although we think that this is a pretty covered area in terms of things for kids and families to do, they're not very effective if kids and families don't know about them, and that the families that we most want to reach or who would benefit most don't even know that the programs exist.